Welcome to Career Elevation, where we make hiring
Two
easy.
formal dinner nerds turned recruiters who've seen the good, bad, the ugly, and the you don't want to miss this stories.
If you're ready for better hiring, better teams, and better vibes,
You're in the right place. Let's elevate your dental world and have a little fun while doing it.
you can learn all the skills in the world, but the real lessons, those come from actually being in it.
So we're here to tell you what we wish we would have known beforehand.
Yeah. So, Destiny, what's one of the moments earlier in your career where you're like, I was not prepared for that? And I wish somebody would have told me before I got here.
I think the biggest thing is that every doctor is going to be very different that you work for. The procedures are going to be the same. The instruments are the instruments, obviously, but you're not going to be using the exact same ones every time. The doctor may prefer something else. And regarding the doctors, with them being different, some of them are not going to be the nicest. Some of them are going to get upset when something goes wrong and blame you, and it's not really your fault. And you have to learn as an assistant a lot since you're working with the doctor to take things with a grain of salt. They're probably going to move on and forget about it by the next patient and not even realize that you're upset. You're going to have some that scream at you and things like that. And I'm not saying stay in that environment. As a recruiter, I'm not saying stay in that environment. Let's make that clear. I am saying, though, that there are cases where you do start working somewhere and you find out that is the type of doctor you're working for. So when you're doing the interview process, make sure that your personality really matches with them. And if you can handle a strong-willed personality doctor, then maybe that's the place for you. But if you're like me, who now I could probably handle it because I'd be like, hey, this is unnecessary. Let's calm down. 21-year-old Destiny, when she became an assistant, could not handle it and would go home and cry every day. So really think about that when you are interviewing places, like what type of personality matches with you. Can you handle constructive criticism or can you not?
I had a doctor that very aggressively handed me an Explorer, and it like, I felt like the poke, not like that it actually punctured or anything, but I was like, did this dude really just do that? Did he really just think that I wasn't going to notice or say anything about it or do anything about it? He definitely did that, and I was not happy with it.
I had a doctor
It's
give me
something
the silent treatment for like 2 weeks, and I worked with him
that,
every
I mean, that doesn't even make sense.
day. No.
Let's be honest.
Are we toddlers?
Must be. Something I wish that somebody would have taught me earlier on in my career was that just because you have insurance from a patient that they've gone through the verification, they have a pre-authorization even to do a service, that still does not mean that insurance is going to pay for it. Insurance can do whatever they want, unfortunately, and it can also take months and months and months, even though you have all of the documentation. Sometimes they just like to drag their feet. And I don't know if they have something on their back end that's like, hey, this employer is really bad. We don't want to pay on time, blah, 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 blah. I don't know if they have a color coordinated system or like why they do this, but it does happen sometimes. And sometimes it happens more with certain insurances than others. So yes, of course, you need proper documentation, but also that does not always mean that it's a guarantee of payment for your services.
That's also a good point. Always get your EOBs from your insurance and compare that too, because when I took Olivia to the pediatric dentist and we got that procedure done, everything they had quoted me, we didn't get all that done. And so I knew I was due a refund and I had to argue the office manager down about it. And she's like, you're not. And I said, ma'am, I already called my insurance and they told me what you owe me. So you're lying. And she was like, well, the fee schedule is wrong. I said, your fee schedule can be wrong at your office all you want, but the insurance company is not wrong. And then she comes back and says, it was right, but I do owe you $500. I said, okay, sure, sure. I don't know. I asked them to run a pre-auth before we did it, and the lady at the front told me they didn't have a treatment coordinator or anything. They had nobody there. Now they only have the office manager. So it makes me as a recruiter look back and be like, I wonder why. I wonder why that you have no employees. The front desk wouldn't run a pre-auth for me. She said, well, this is the fee schedule. This is what it's going to be. I said, no, ma'am. No, it's not. I said, a pre-auth is more likely to be correct. It may not always be correct, but it is more likely. And she's like, you don't need it. And I was like, she just literally would not do it for me, even though I asked. I was like, this is mind-blowing to me right now.
Yeah, I mean, any amount of service that I think is probably over like $500 or 1,000. I don't know if people, I'm sure I haven't been in an office in a handful of years, but anything over like $500 is not pocket change for most people,
Not in
And so
today's
if you have,
economy, for sure.
Yeah, and there's a lot of offices that they are like, we need this to be paid the day that the service is done. And if for some reason it's denied and you end up with that bill, you're not anticipating that. And then the office is going to be mad that you can't pay it all in full. People don't have that kind of spare change, you know?
Well, and that kind of leads me to something I feel like you and I both realized we wish we would have known beforehand is that you're going to encounter a lot of people who don't have the means to afford the care they need. And it sucks to see that. And it sucks to see them in pain or just not confident. And you have to listen to their life story and you have to learn to be empathetic in a way without making them feel like you feel bad for them too. So it's a lot of balance and emotions in that aspect and being little therapists too.
Absolutely. Yeah, we are definitely therapists in the dental office.
What's something that seemed really small for you when you first ever got in dentistry, but it took you forever to actually figure out how to do it?
Being incredibly articulate with my words and knowing the right thing to say to help the patients feel the most comfortable that they possibly can, especially when they're requesting to see a different team member. Like if I'm going in to sub at an office and they're like, well, where's Sally? She's been my assistant for the last 23 years. And you have to be able to find the right words and verbiage and what you're comfortable with. And if the office has given you certain things that they want you to say, but being able to just put a smile on and not be upset if they do ask for a different person because they're not there and you are the one that gets the opportunity to help that patient. So allowing and helping that patient to feel as comfortable as they possibly can. Like I feel like I have just such a stupid big grin on my face every time I see patients that they're immediately like I can see their face being like, why are you smiling so big? Like this
I feel like
last
I
weekend I
smile a
just
lot too.
yeah. Well, and I don't get to help patients as often anymore. I just do it for volunteering. And this last weekend, I would go gather some patients and I could see the look on their face like, why are you so happy? It's such a good and rewarding feeling to be able to volunteer. And I know that it's not like an everyday thing and that I don't get to do it very often, but I think that it really puts them at ease a little bit more, even just having like a stupid big grin on your face.
Like you enjoy being there. At my last office I worked at, Dr. Ward's office that I always talk about, when I first started working there, his wife was the main assistant, the only assistant. And so everybody wanted to see her. They were nervous about who I am. They're all from here, so they knew them. And finally, after I worked there for 3 years, everybody knew me too, but I moved away and now I've moved back to the area. And I was actually at TJ Maxx a couple weeks ago and I ran into an old patient and she goes, Destiny, where have you been? You just weren't at work anymore. And I was wondering what happened to you. And they told me you had to move away from the military. Are you back? I miss you. And I was like, that warmed my heart because it went from them not wanting to see me because they were unsure about me, didn't know me, to now it's been God, 3 to 4 years since I've worked, 4 years since I've worked there. And now they still remember me and like mention that. And I was like, that is so sweet.
Oh, oh, I love that so much. What's something that seems small initially to you, but you think it took a little while to figure out?
So mine was the Tofflemire Matrix retainer. I still to this day, probably if you put me back in the office and you told me to put one on, I would probably put it on incorrectly. Just
Mm.
because it's so nitpicky, they're flimsy. You might get two when you pull them out of the drawer. It's just such a pain in the butt. I honestly would rather put on a rubber dam, which I don't enjoy those either. So there's that. But I don't even know if offices use those as much anymore if they've moved on to a new matrix system. It's been a little while.
Yeah, there's some that are single use that are really, really nice. They're plastic and you can twist the end and it
Oh,
just
you know what? I have seen those. You just have the little tool and you just stick it on. That's a lot better.
yeah, it's nice. Yeah. What's something that you wish someone would have told you before your first day in dentistry?
It's okay if you don't have everything you need at the tip of your fingers. So there's going to be times where you get into a procedure and it's going to go differently than the usual procedure. Everybody's mouth is different. Though you're doing the same procedure, every person is a different person. Their teeth are different. The dynamic of how you and the doctor are going to work in that procedure are going to be a little different. So they may ask you for something that you don't usually pull out. Don't panic. That was my time. All the time I would instantly get anxious, like, oh my gosh, I don't have this out. He's going to be mad because my first dentist would have been. But not every dentist is going to be like that. Just take a breath. Take your cotton pickups, the clean ones that you keep to the side, pull it out of the drawer if you need to, deglove if you need to, call another assistant in there to grab it if it's not in their room. You're going to get the procedure done regardless if it takes a minute to get what you need to get it done. Just take a breath. It's okay. Don't panic because that was me. I was full of anxiety about it. I was like, oh my gosh, I don't have everything I need. But then I learned I was putting too much out sometimes. I was taking out too many cotton rolls, too many gauze, and it's like now I'm throwing things away, which in the end of the day, throwing two gauze away per procedure doesn't seem like that much, but it adds up. And it does add up money toward the office that they're spending on those things, which I don't think everybody always thinks about. And I think once you get further in your career, you begin to think about these things to try to help the doctor. But when you're a first-time assistant, you're just like, oh, it's fine. I'll just throw this many gauze on there. You have to start thinking about the little things. So that was for me the biggest thing that I wish I would have been told that it's okay. The end of the world is not going to happen.
Yeah. In dentistry, we are so wasteful as it is because we have to use so many things that are disposable. I think medical is a lot worse, at least hospitals.
Oh, yeah.
But, that's also a secondary thought too. And something that always kind of just, I didn't like within dentistry is how much trash that we make. And I get it. I understand the reasons behind that, but that always kind of was a little unsettling to me.
I had an office that just wanted me to put my foot in the trash can to push the trash down so they didn't use as many trash bags. And I was like, I'm not going to do that.
Mhm.
They were
Yeah.
like, why? And I said, because now, like, my foot's been in there. And now I'm
Hmm.
walking all over the office and at the front desk.
Hmm.
No,
Right.
I'm good.
And kids, no matter how old they are, they're still going to touch the floor and put their hands on the floor and sit on the floor. It's gross. They don't get it.
No. So what's something you wish you would have known when you look back? Like, what is the first thing you wish you would have just done when you started?
Listen more and take notes because you don't have to remember everything. Your notes can do it for you, especially in the beginning. I think taking notes is very helpful and leading with empathy. Sometimes I think we want to get the solution to them right away, but really, I think that if we're leading with empathy, I think that will go a lot further than here's a solution for you right away. Sometimes being as fast as you can isn't always the right thing to do. And also, not everything needs to be said out loud. So, for example, if you have a question and the patient's there in front of you, you don't always want to ask it. That's why I say take notes because you want to ask the question, you just don't want to ask it right there in front of the patient. One of the probably easiest examples to say is like if the patient's bleeding and you have a newer person observing, you don't want to say, why is there so much blood in the patient's mouth? The patient's going to freak out. And really, it's probably not. It's probably 3 drops of blood mixed with their saliva, and it looks like a lot, but
Yeah.
it's really not. But same thing with insurance. Let's say that it says that it's denied or something, or that their insurance is inactive. You don't need to say that out loud in front of a patient. They're going to freak out a little bit. They're going to go and call or do something when really maybe it was just an error, or you as the person who's working at the practice, maybe you did something wrong or the insurance did something wrong, and it just takes a quick phone call or a refresh of the system instead of freaking somebody out.
I agree. When Mike got his wisdom teeth removed, it was on a military base, and I worked in the oral surgery on the same military base he got them removed, obviously many years later, but his oral surgeon got one of his root tips stuck. Obviously, back then I didn't know anything about dentistry. He didn't know anything about dentistry. Now he would have been more understanding, but she goes, uh-oh, this is not good. And he's
Oh,
awake, and they keep all their recruits awake. So he's like freaking out. He's been away from home for weeks at this point with no contact. So he's like, what do you mean this isn't good? And she's like, hold on, I'll be right back. I got to go get somebody else. And Mike said it was just so scary. Don't say that. Don't say, oh, that looks weird. Oh, that's not normal. You are literally going to freak somebody out. People who don't know dentistry, you start rattling off numbers and surfaces of what needs to be filled, that freaks them out. They have no idea what you're saying. You sound like you're
yeah.
talking alien.
I mean, and dentistry is basically another language, let's be honest. It's hard to understand it the first time you go into the practice. And so that's why you need to take notes and just listen and see if you can connect the dots. So it's
I,
a
I
great career though.
I have a friend who's a nurse practitioner, and she literally texted me a picture of her son's teeth the other day because his adult teeth are growing in behind his baby teeth, and the baby teeth aren't super loose yet. And she says, what do I need to do? Do I need to take him to the doctor? Is something wrong? And I was like, it's fine. I was like, Sophia's grew in the same way a lot of kids do. I said, if the teeth start to move forward and get the other ones loose, then great. I said, watch it for a little bit. She's like, do I need to go to the dentist today? I was like, no. I was like, watch it for a little bit. If they don't get loose because they're not pushing forward, then take them to the dentist. They can pull those quick and easy. It's not going to be any big deal. And then those teeth will move forward. And she was like, okay. She was like, thank you, God. I was so nervous. I'm so glad I texted you. I was like, and the fact, like, she's a nurse practitioner and she knows way more than I do about medical, but she doesn't know dentistry because, like you said, it's its own language.
Yeah. And I think they only have one quick semester on dentistry or something like that. So they know a little bit, but how much of that are they really going to retain when they don't actually have to do anything
Didn't you
within
tell me it's
dentistry?
like 5% of everything you retain, or like 1% of every conversation you retain the info?
Yeah, I think it's 6% if it's verbal or written. I don't remember. I don't know. It's a very low percentage. I think it's 6% if it's verbal and 15 or 20% if it's written. Either way, it's a very small amount of things that you're going to remember anyways.
But back to your notes. Another thing about taking notes, be really fun. Get some tooth related things. Like Wendy made me this dental recruiter notebook, and I'm always filling something out in here. I don't ignore my crazy,
Yeah.
but make it fun. Get some tooth pins, all kind of different things. I always loved that as a dental assistant, having fun things about teeth.
Yeah. Yeah, absolutely. My birthday was 2 days ago and my mom got me a drill bit set that looks like a teeth.
Stop.
And she's like, and look, the front one's a gold tooth. And I was like, oh my God, you
That
are adorable.
I
Yeah.
love.
I don't think I'm going to use it. I think I'm going to put it on display up there or something. It's going to be really cute.
So obviously you and I have trained dental assistants. We've helped train front desk. We obviously help with onboarding situations now, but if you could add one real life lesson into dental training, what would you do for it?
Mm, I would probably say how to answer a question. Like if a patient is asking you a question, give an answer that satisfies quickly, but it doesn't have to be the entirety of the answer. And then, especially if you don't know the answer, write it down, go to somebody else on the team that has the answer, and circle back to that patient either in that appointment or when you call and check up on them and say, hey, how you doing after that crown? And then say, like, I also wanted to tell you X, Y, and Z after you had left. I remembered this or something along those lines, so that you're giving them all of the information that satisfies their question, but you initially had answered it. So again, that's just something that it does take a little bit of time to learn and understand, but you don't always have to say, sorry, I'm new. Sorry, this is my first day, or I haven't done this procedure before, or anything like that. Answer in a way that does not make it seem like you are brand new or brand new to this procedure. You could have been an assistant for 20 years, but this is a new procedure to you, so they're already seeing, oh, this is new. I don't know how to do it, even though you have 20 years of experience.
I feel like you did that even when I started being a recruiter. You're like, you don't have to tell them that you're a new recruiter because
Yeah,
I was nervous about doing interviews and it's like, why am I nervous? I'm the one interviewing you. So I had to get
yeah,
that in my head too. They don't know the process I'm doing. They don't know that I have only done however many now. I mean, I've done hundreds now, so it's not.
yeah.
Actually, I was looking up my 2 year anniversary is next week.
I
And I
know.
said, I just realized that because it's on Elisa's birthday.
Uh-huh. Yeah, I know.
What a good
I'm
birthday
very
gift to
excited.
her with me.
Ah.
I just love that. But I definitely agree. You don't have to tell people you don't know anything. You don't have to guess. I wouldn't guess on an answer because then if you're wrong, you've said it already and now they're going to quote you on that and it looks kind of bad. So if you don't know something, you can just say, that's a good question. Let me do some research or let me talk to the doctor and get back with you. I'm not the doctor is a term I always like to use when they're like, do you see anything on an x-ray? I'm not the doctor. Let's let him or her take a look at it and then we'll see. So because
Yeah,
they think I probably do know what's going on. I probably do see it, but I'm not legally allowed to tell you that.
yeah, yeah. Or I think if a patient says, what do you see on the x-ray? I think it's a good idea to say something along the lines of, that's a really great question for doctor. He has a full evaluation that he's going to put everything into the same picture. I'll go get him and he'll be able to explain that to you a little bit better. So again, it's like deferring the answer to somebody else that has the power to be able to accurately answer. And the patient still thinks or feels like you know what you're doing. That's just the answer that you're supposed to give. So I like that. What's one real life lesson that you would bring into dental training?
So, I did train dental assistants for a while through the Red Cross on the base. And I love all my girls I got to train. I still talk with most of them. We placed one of them at Illuminate, and she's doing amazing. She's doing all her social media now, and it looks great. But one thing that I really always wanted to hone in with them is that as much as you know about the teeth and as much as you know about the procedures, make sure you know how to talk to people, how to have a heart for people that People are going to come in scared and anxious and maybe angry some days, and it's not against you all the time. Maybe it is. Maybe they don't like you, and that's okay. If you're not someone's cup of tea, they don't have to drink it. You've always told me that, and that's fine. I'm not everybody's cup of tea. You're not everybody's cup of tea, but I try to be something worth tasting, at least, I guess, in the best way, just by being a positive energy and coming in and saying, hey, I know this is probably not where you want to be today. If somebody jokes with me, I say, how are you today? Well, I'd rather be anywhere but here. I'd always be like, me too. Do you want to leave? Should we go get coffee? I mean,
Uh-huh.
at the end of the day, just being understanding and being a human, that they are human beings and they have emotions and life, and it's unpredictable about what may happen. I know it's frustrating when people cancel appointments and things like that too, but having that understanding of like, what if something happened to you? What if something happened to their family? Just getting the fact that it's not just about teeth, it's about the people themselves. They want to come in and have an experience at the dentist office. You want them to leave and say, that wasn't bad at all. I got to have a good conversation. They offered me coffee or a water. I got to watch some TV or whatever's going on, listen to some good music, and they leave happier than they came, even if they're still not the biggest fan of the dentist.
Absolutely. Well, I think that's a great way to end this podcast. So I think that's a wrap for today. If today's episode gave you a laugh or a tip, or maybe just a little bit more sanity, hit the follow button and share this episode or any of the others that we have with somebody in dentistry who needs a tiny little miracle in their hiring life.
We got more stories, strategy, and sass coming your way. But if you have any questions or want us to talk about anything, feel free to leave a comment. We would love to get some more engagement from our viewers.
Absolutely. Until next time, stay elevated.